Hello class, this is Dr. Alendi and welcome to Anatomy and Physiology 1. We're going to have a fun time and we are going right into and we're starting with exercise 1, Anatomical Terminology. So exercise 1 is self-study, but I made this video to help you along to make sure you know the important information when it comes to anatomical terminology. So, if you are on Central Campus, this is your lab practical review list. This is at the end of every exercise. Everything that is on this list you should be familiar with. This is what you're most likely to be tested on when it comes to exercise 1. All right, and we're gonna go through all of this today. All right. So now we are in a hypothetical situation. Let's say you are a surgeon and you are about to make the first incision. You are inferior to the umbilicus in the mid-sagittal line towards the pubis, and the goals are remove a cyst from your patient's right ovary and ligate the ipsilateral uterine tube. Well, that's a lot of, I try to highlight some important terms here: inferior, umbilicus, mid-sagittal, right, and ipsilateral. What are these terms? What are these terms referring to? That is what we're going to learn about in this exercise. So first off, anatomical position. This is a precise standard for anatomical description and dissection. If I'm in another country, if I am in another state, in a different time zone, if I know that the person is situated in the anatomical position, I know exactly how to visualize it and I exactly know my reference point. That gives us a generalized reference point wherever we are. This is an important reference position, and you should be familiar with this reference position. So anatomical position means the person is standing upright, their feet are flat on the floor, and their feet are also close together. The arms are at the sides, and the palms and the face are directed forward, facing the observer. So you are going to utilize and this position when referring to your bones, to the muscles, to the arteries, to the veins, to the nerves. All of this is in reference to the anatomical position. So please know what it means to be in the anatomical position. Some directional terms and reference terms used for human anatomy. So since we are becoming human anatomists, we don't say my forehead is above my nose. We say the forehead is superior to the nose. We say that the heart is inferior to the head. Ventral or anterior means towards the front or the belly. Dorsal or posterior means towards the back or the spine. Ventral and dorsal are usually used in animal anatomy, and anterior and posterior are usually used in human anatomy, but they are often used interchangeably, so be familiar with both of them. Medial means towards the midline, lateral means away from the midline, proximal means closer to the point of attachment of a limb to the trunk, distal means further from. Superficial means closer to the body surface. Deep means deeper to the body surface. Ipsilateral means on the same side of the body. Contralateral means on the opposite side. Parietal means this is a term that means in reference to the body wall, and visceral is something that is closer to the internal organs. So let's go through these terms in a little bit more detail. So here we see most of the terms on one slide. We have, of course, left, right. We have medial is towards the midline. Lateral is away from the midline. We have in reference to the limb, further from attachment. So the fingers are distal, but the shoulder is proximal. Here again, we have proximal versus the feet are distal. Anterior or ventral, posterior or dorsal. superior above, inferior below. So those are some of the terms. Let's now go through some our planes and our sections. So many views of the body are based on real or imaginary slices called sections or planes. A section implies an actual cut or slice to reveal the internal anatomy, but a plane implies an imaginary flat surface. So think of a piece of a mirror going through the body and separating the body into different planes. So we have sagittal plane, frontal plane, and transverse plane. There's also oblique. There's also an oblique plane as well. So let's take a look at our planes. So again, reference point is anatomical position. Feet flat on the floor but close together. Palms facing forward. Face is also forward towards the observer. So we have our median or our sagittal plane. That is this one here in blue. The median or the sagittal plane, it passes vertically through the body or an organ, and it divides the body into a left and right portion, or left and right side. Frontal or coronal plane. So this is the frontal plane or coronal plane. Coronal, think of someone wearing a crown. So coronal, if this lady were to wear a crown, it would separate the body into a coronal plane or a frontal plane. And it divides the body into anterior and posterior. And then we have transverse and horizontal plane. So transverse or horizontal plane here in orange. This divides the body into a superior half and an inferior half. We need to know your planes. You need to know how to describe them and what they divide the body into. So let's take a look at our terms again. We have ventral or anterior, dorsal or posterior, superior, inferior, medial is towards the midline, lateral is away from the midline. So we have medial versus lateral. We also have proximal versus distal. Ipsilateral means on the same side. Contralateral means on the opposite side. So here, for example, we say that this person's liver about here is on the same side as this person's right clavicle, ipsilateral. But this person's heart is contralateral to their liver. Yes, opposite sides. We have superficial and deep. The skin is superficial and your bones and muscles are deep. And then we have cephalic versus caudal. I'll have that in the image below in the upcoming slides. So here I have some examples of the directional terms in more detail with examples. More examples here of all the terms you should be familiar with. So ipsilateral on the same side of the body. The liver is ipsilateral to the appendix. Contralateral means on opposite sides of the body. So the spleen is contralateral to the liver. Then we have some terms we often use in reference to the brain and the head. Cephalic means towards the head or the superior end. Rostral means towards the forehead or towards the nose. Caudal, here caudal means towards the tail or inferior edge, so the spinal cord is caudal to the brain. All right, we need to know all of these terms. Let's practice. Which plane of the body divides the body into a dorsal and ventral region? What is our answer? Hopefully we're all saying coronal. And again, instead of saying dorsal, we can also say posterior. Ventral, we can also say anterior. Next question. The anatomical position could be described as which of the following? Anatomical position: lying down prone, lying down supine, standing displaying the ventral surface of the body, standing with the arms and legs abducted. Hopefully we're all saying C, standing displaying the ventral surface of the body. And then we have one more question. Which of the stated relationships is correct? Is the heart inferior to the clavicle? Heart, clavicle, okay. The shoulder is distal to the carpals. The phalanges, so your fingers, are proximal to the metacarpals. And the eye is medial to the eyebrows. Which one of these is correct? Some of the terms you might not be familiar with, but hopefully one of them was able to stand out, and that is the heart truly is inferior to the clavicle. All right, so those are the terms you need to be familiar with. Now let's go through our body cavities. So when it comes to our body cavities, we have a dorsal or posterior cavity, and we have a ventral cavity. In this image, we see the posterior, which is the cranial cavity and the vertebral canal. Ventral cavity, many more. We have our thoracic cavity and our abdominal pelvic cavity. Start up with the easier one, our posterior aspect or our dorsal cavity. We have the cranial cavity. What do we find in our cranial cavity? The brain. And we have our vertebral canal where we find our spinal cord. That's it for the dorsal cavity. Now let's take a look at our ventral cavity. Our ventral cavity is made up of the thoracic cavity as well as the abdominal pelvic cavity. The abdominal pelvic cavity is made up of two cavities, which these are the abdominal cavity and the pelvic cavity. Abdominal cavity, it houses our digestive organs, the spleen and the kidneys. Abdominal cavity here, and then our pelvic cavity, it houses the bladder, the rectum, and the reproductive organs. Then we have our thoracic cavity here. Mid-sagittal view and the coronal view here. Your thoracic cavity is made up of pleural cavity. What do we find in our pleural cavities? The lungs. We have our mediastinum. In the mediastinum, here we find the trachea and the esophagus. And then we have our pericardial cavity, in which we find the heart and our great vessels. So, our body cavities, dorsal or posterior and ventral. Dorsal is the cranial cavity and the vertebral canal. Ventral cavity is the thoracic cavity and abdominal pelvic cavity and its other components. Yes, we will be familiar with our body cavities. And then in our cavities, what do we find in those cavities? So again, like I mentioned, in the cranial cavity, we have the brain, and then the cranial cavity is covered by a membranous lining called the meninges. The vertebral canal, we find the spinal cord, and it's also lined by the meninges. In the thoracic cavity, we have the pleural cavity, where we find the lungs, and the pleural cavity is lined by pleura. In the pericardial cavity, we find the heart, and the heart is lined by pericardium, and we also have our mediastinum. Then we have our abdominal pelvic cavity, which is made up of the abdominal cavity and the pelvic cavity, and they are lined by peritoneum. All right? We need to know our body cavities, the associated viscera, so the associated organs, and the membranous lining. All right? We will know that. Regional terms and body regions. We also need to know this. So, this is anatomy. So, now if we are referring to someone's foot, we don't just say foot. That is the pes. That is the pes region. If we say arm, we don't just say arm anymore. We say brachial. We don't just say forearm. We say antebrachial. We don't just say wrist. We say carpal. We don't just say the head, we say the cephalic region. We don't just say the eye, we say the orbital region. All right? We need to know the anterior view as well as the posterior view. So now we don't just say heel pain, we say calcaneal pain. We don't just say the calf, we say the sural region. We don't just say the lower back, we say the lumbar region. We don't just say the elbow, we say the olecranon region. My favorite word is the back of the knee. That is the popliteal region. All right? But we should be familiar with all of these regional terms and body regions. And the thing is, it might be a little bit more difficult in the beginning, but once you know these terms, once you start learning the muscles and the bones, you'll notice that, oh, that's why it's called popliteal, because there's a popliteal fossa there. Oh, that's why it's called the brachial area. That's because we have the biceps brachii muscles there. So it all eventually will benefit you to learn these terms now. All right. For example, the chin, the mental region, you'll learn that there's a muscle there called the mentalis. So that is why we need to know all of these regional terms and body regions. Yes, we will be familiar with all of them. Then we also have our abdominal regions and our abdominal quadrants. So your abdominal pelvic cavity is quite large, and it houses a lot of important organs. So that's why it is separated into different 9 abdominal regions and 4 quadrants. Let's start with the easier quadrants. First, we have to orient ourselves. We know that this is the person's left side. Let's draw it in. We know this is the person's left side. This is the person's right side, right? Therefore, if this is left, this is the left upper quadrant. This is the right upper quadrant. This is the left lower quadrant and the right lower quadrant. Same here. The regions, we have 9 of them. So starting off here, this is left, this is right. We have our left hypochondriac region, our epigastric region, and the right hypochondriac region. Yes? Here in the middle, we have our umbilical region, and on each side, we have the left and the right lumbar region. So left lumbar region and the right lumbar region. What is lumbar again? Your lower back. Awesome. Then we also have our hypogastric region. So we have epigastric, and then we have hypogastric. We then have our left iliac region. This is the iliac crest here. So left iliac region and your right iliac region. It is also called, let's go all the way down here, the left inguinal region, because your inguinal canal runs through there. There's the left inguinal region and the right inguinal region. All right, we need to know our regions. And then we have 11 human body systems. Each organ, we have 11 organ systems. In the organ systems, they have associated organs, and we need to know the functions of these organ systems. All right, we have the integumentary system, skeletal system, muscular system, nervous system, endocrine system, circulatory system, lymphatic system, respiratory, urinary, digestive, and the reproductive system. All right, this is a table from your book, so this is what you need to know. But let's go through them in a little bit more detail. So here we have your integumentary system. This is your skin, hair, nails, and your cutaneous glands. Your skeletal system is your bones, cartilages, and your ligaments. Your muscular system is your skeletal muscles, easy enough. Your lymphatic system is made up of your lymph nodes. All of these little bean-shaped structures are your lymph nodes. Then we have the lymphatic vessels. We have this organ here is called your thymus, your spleen, also your tonsils. They all belong to your lymphatic system. We have the circulatory system, which is made up of your heart and the blood vessels, so your arteries and your veins and your heart. We then have the respiratory system. Your respiratory system is made up of your lungs, your trachea, your bronchioles. We also have our urinary system made up of the kidneys, the ureter, the bladder, and then the urethra. And our digestive system, here we see the mouth, the esophagus, the stomach, your large intestine, your small intestine, and accessory organs like your liver, your gallbladder, and your pancreas. Those all belong to the digestive system. We also have your nervous system made up of the brain, the spinal cord, nerves and ganglia, and the endocrine system is made up of your pituitary gland, your pineal gland, this very small gland located in the brain, your thyroid, your thymus as well. We have our adrenal glands superior to the kidneys, the pancreas, the testes, and the ovaries. All right. And then we have the male and female reproductive system. All right. So let's go back to the table. Okay, I can go back to the table, but what is in that table is what you need to know. All right? So let's practice. The yellow arrow is pointing at which body cavity? Which cavity houses the brain? Hopefully we're all going to say the cranial cavity. Here we have the lungs. The lungs are what to the heart? Hopefully we're all saying the lungs are lateral, right? The lungs are lateral. Then we have the stomach. Here we have the stomach. The stomach is what to the diaphragm? The diaphragm is located about here. The stomach is. Hopefully we're all yelling inferior. Then we have the liver. The liver is in what quadrant? Hopefully we're all saying the right upper quadrant. The red arrow is pointing at which abdominal region? Hopefully we're all yelling umbilical. Awesome. And here we have the arrow purple belongs to which organ system? I'm pointing at the skin. And the skin is a part of the integumentary system. Awesome. And then you have in your lab manual the diffuse section. Please go to the diffuse section. It's very helpful. If you know the diffuse section material, if you have gone through the practical review list, you've gone through the lab manual, you should be set for your in-lab quizzes.